and no need for apologies. I get frustrated and angry when I believe different views than the clients because of what I've witnessed and seen. So this is what we have to do. The GcMAF, I usually, the first week when a client arrives here, will use way too much, like up to 10 syringes with 0.7, almost a mil in them, and I'll do the whole spine. What I'm doing with that is I'm trying to protect, to stop, and I've never had anyone's cancer progress as a result of doing this. I go back, I think I told you the story. The first client that I had results with GcMAF was very early in the show, and he had 4 vertebrae that had tumors. We injected them. He had tumors elsewhere, but these were going to lead to him being a paraplegic. We injected the 4. He done the rest of the protocol that I have in my home pack, and in a period of 6 weeks, he saw they done a CT scan, and what they were threatening him to become a paraplegic was gone. It was no longer an issue. There was no tumors there, but there were tumors in other places. So the oral and in the vein, and in the location made a very big difference. Also, this man, similar, same path as you, they're all different, but pressure from Big Brother, he decided to go because the one in the rib didn't disappear and one other one didn't. We didn't inject those locally. And so he chose to go down the path of chemo and radiation then, because they couldn't help him. He was going to be a paraplegic, and he got talked into doing chemo and radiation. He came back a year later. His whole spine was full of tumors, except those 4 that we injected. Like, that's mind-blowing evidence to me of the protective value of GcMAF. So always when clients arrive here, all the way down the spine, I inject the total spine. It's like a dice. There's the vertebrae, and you're going if this is the vertebrae, you're going each side of it, not on top. Unless you pinch the skin, you're not going into it. You cannot do any damage. Orally, 0.3 of a mil, 0.5 the first week, 3 days a week. Everything is 3 days a week. But then I use a lot. Use a lot. It's very expensive, but that's why my program costs what it costs, because we don't hold back on how much we use of everything. So then I reduce the next week, and then I reduce again. So when you're at your stage, you've been doing a lot every day is not necessary. And so I presume the locations where you're injecting aren't healing in 24 hours. So I would be doing around the area where you know you have the tumor. I would make sure there's about a mil in that area. And in the rest of the area of suspicion or any area of pain, less than that. It's about, also most people, it's about budgeting. But I would be hitting yours pretty hard right now. I'd be here and I'd start the high pH therapy day 1. Because of the stage you're at, and you've been doing a lot of good things before you came here, and that thing will stop growing the day we start, and we should shrink within 7 days, and you should be walking normal in 14 days. That's where I'm at, and that's what I was trying to relay in writing. So I think that explains it. So just you can't overdose on this product, okay? It's harmless, but there's no need to do that much. There's no logical reason why injecting local works, because this product is mixed with vitamin D and works in the area and is made in your liver. It doesn't make sense that it works, but it does. It does 100% work. I've had breast tumors where I've injected the bigger ones, left the other ones, and the bigger ones have gone. The other ones are still there. Injecting local, it may be because of the injury you're doing in the area, attracts the immune system, I don't know. But 100% without doubt, injecting in the local area makes a difference. Okay, and you know, people are talking about that benefit. I'm talking hands-on experience. All the other people selling this product that use and comment similar to what I'm saying, or they may choose to go the opposite way just to be different for marketing purposes. But I'm just talking hands-on experience. Everything I do is based on not necessarily what I read and learned 10, 15, 20, 24, 23 years ago when I started. It's what I see. Okay, so that's that. DMSO you can buy locally, so buy the 100%. DMSO, once it's mixed with anything else, is useless. It has an energy that heats up as soon as it's put on, when it's mixed with any other liquid or put on your body. This product increases the penetration of everything you do and decreases pain. So I put it on the day before. I give it IV, up to 10, it depends on the size of the person, 10 to 20 mil IV, but usually 10 mil. And it has a bad odor to it, so if you massage your wife's feet, put a little on hers and she won't notice that you smell like garlic. And that can definitely help with all the other therapies and get more penetration. Yeah, so I think that answers your question. And I do some things that nobody thinks is important, but I also get liquid vitamin D, rub it in the area. When I put the DMSO on, it carries it into the body, into the area. The most important thing is vitamin K2. Whatever, if you're taking double or triple the amount of vitamin D, you need to take double or triple the amount of vitamin K2 to stop bone spurs, which also can cause pain and future problems. So that's just a brief. If you can download WhatsApp, I can do quick short messages to you that are clear. You hear my voice, because the interpretation of words, and especially when I'm with other people, between clients, I write something quickly to you and it can be misinterpreted. I'd like to avoid that. So WhatsApp, all my clients are on WhatsApp. I answer them all as quickly as possible, and it works better that way. So anyway, my friend, you have a great day. Hope everything's going well, and let's catch up on the phone whenever you're ready. Until then, you have a good day, and bye for now.